Now, the South African Medical Association trade union is calling on the National Treasury to intervene in the unemployment crisis of healthcare workers. The union say they're concerned about the country's ailing healthcare system. This follows a series of protests around the country to highlight the plight of unemployed doctors. For more on this, we're joined by SAMATU General Secretary, and that is Dr Cedric Sihlangu, who joins us now. Dr Sihlangu, thank you so much for the time. Appreciate it. Why National Treasury? Why not the Health Department?
Thanks, Robert. Thanks for having us. Look, you'd be aware that we've been doing this now for a couple of years. I'm sure this is the third or fourth year where every year we have to highlight the plight of, by and large, unemployed healthcare professionals. Of course, we really bring out the issue of doctors languishing at home. Now, every year we go on a march to raise the plight. The National Department of Health, together with the provincial health departments, will always cite the issue of budget cuts and austerity measures from National Treasury, and also accounting to the fact that they themselves are unable to deal with the issues of dilapidating infrastructure in the facilities, the equipment that have broken down and of course are not being repaired, and they point solely towards budget cuts in National Treasury. So the national leadership of SAMATU, of course, in liaison with COSATU, our federation, then took a decision that we will lead this march directed to the finance minister. And it's not only a march for doctors, just to be clear, it's a march for all healthcare professionals. That includes your dentists, your pharmacists, your nurses. So all of us today are headed to the Minister of Finance's offices.
Yeah, Cedric, but I only ask this question as well specifically because National Treasury can give money to the Department of Health, and they then need to prioritize correctly. If they don't do that, they're the ones to blame. Getting more money from National Treasury may not necessarily change the priorities. Or is your hope that National Treasury will earmark particular sets of funding for exactly this?
Precisely your point, your latter point. That's exactly where we are going. We're saying there ought to be a ring-fenced amount that gets allocated, or in this particular instance, reallocated, because the money is there. I mean, the money gets utilized for sometimes very ridiculous things. There are some, tender processes that you find a loaf of bread is a line item at 100 Rand per loaf of bread. I mean, that's ridiculous. So indeed, the money is there. It needs to be properly ring-fenced for the purpose of ensuring that there is adequate, healthcare workforce. Because again, this, it goes without saying that without the healthcare workforce, you can't even implement the NHI. So what we are saying to National Treasury is that, yes, notwithstanding the fact that every province is saying there's been a diminishing budget, we are saying that which is there, a portion of it must be allocated to the health workforce in terms of appointment. And remember, there are posts which are unfunded. What we are saying to National Treasury is that there must be funding of those critical posts, because it doesn't make sense for a government to defund a critical service like that of healthcare, because it's a human right. But let me just quickly touch on one point, if you'd allow. The unfortunate reality is that people like the Minister of Finance and the Minister of Finance, you name them, they can easily defund health because their interests are secured. They're insulated by the private healthcare which they subscribe to. They utilize PARMED, and they are guaranteed to see medical specialists. They are guaranteed to see any physician when time comes. But the bulk of the population, which is the masses of this country, are not guaranteed that opportunity.
I'm just looking at the government spend here as a percentage, really, of government's consolidated government expenditure by function. Just as a figure for 23-24, it was allocated around 267.3 billion rand. That figure, just in relation to the rest of this, looks like ultimately the fourth highest amount here. Of course, learning and culture being the first, social development being the second, but actually health being the third biggest figure we spend. What's going wrong? Why is the spending not going sufficiently into something like this? Is it because it's going to infrastructure? Do you know?
Yeah, let's first accept that the amount allocated, remember, the austerity measures are real and the budget cuts are real. We don't deny that. In fact, if you look at the allocation over the 2 years from the previous Minister of Finance and this one, indeed, there have been substantial cuts in the budget. But even with the amount that's available, a large portion of it, we still believe that, the way things are in government, in health particularly, it's you've got what we call a hydrocephalic department where you've got so many executives, the DGs, DDGs on DDGs, who, and quite substantially, and that money is not filtering down to where it's needed most, to your nurses, your porters, your cleaners in the facilities, your doctors. And that's one of the other portions that actually contributes to this crisis. What you're seeing here is an outcry of critical skills that need to be the ones actually servicing the population. Of course, there's issues of a component of it that will go towards issues of infrastructure. We know clinics are being built, hospitals are being built here and there. But the unfortunate reality is that you have white elephants now where a hospital is built, but there's just no workforce.
Does that mean that all the money is actually, or it would be better for a lot more doctors to actually head into the public sector, into the private sector, should I say? Is that where then you're seeing them all go because perhaps there's better funding?
It's actually not a solution. In fact, that would be a devastating state of affairs if doctors were to just simply migrate to the private sector, because 80% plus of the population relies on the public health sector. Yeah. And you know that people are relying on a 350 Rand grant. Yeah. That 350 is meant to last you the whole month. Now, a single consultation in a private GP practice is 600 Rand plus. So if you are sitting with 350 in your pocket, deciding whether to buy pap and bread for the rest of the month or go and consult for your flu, chances are you'd rather spend your 350 on food. And that's the problem, that bulk of the population will not be able to afford private healthcare. So we don't see that as a solution. In fact, what government needs to do, it needs to prioritize its people, bail out its people in terms of investing in healthcare. We've seen this government bail out Denel, bail out SAA, bail out airports company South Africa. Why can't it bail out the poor and the indigent by ensuring that they have access to adequate healthcare?
Yeah, because that seems to be one of the suggestions that were actually put forward here by the Minister of Health, in saying that they ought to switch to private practice or look for work elsewhere, which of course demonstrates a different sense of, I think, sensibility when it comes to this altogether, is possibly the word I could use. What would a national health insurance help with? Because we're working on implementing that, but can it be implemented without having all these doctors come to the fore and come to help ultimately?
There are 2 points I'd like to make on that one. The first one by the minister, I mean, that's completely regrettable that you say doctors should go to private or alternatively seek employment opportunity overseas. I mean, you can't invest so much as a country, a developing one for that matter, and then export your most precious resource, your critical skills, to the foreign markets, to Europe. I mean, that would be really an unthinking government. So that one is completely out. And in fact, these very skills, you need them for the implementation of the national health insurance, because it will need critical skills. It will need the nurses, it will need the pharmacists, it will need the doctors. So you need to retain these skills here and actually give them the employment opportunity. But what you're seeing at this moment is that the people who are making the decisions, who preside over this public healthcare system, because they are not subscribing into it, and because they have this PAMED, which we've made a call that PAMED needs to be scraped off, and all government ministers and MECs must actually be compelled to utilize the public healthcare system so that they can feel the plight of the people, so that they can stand in queues like the rest of the society and feel how it feels to get to a clinic and not find a Panado. But until then, you have this two-world, dualistic situation where the ministers are insulated, so they enjoy all the luxuries of first world medicine, and the rest of the population will simply see to finish. And that situation is no longer untenable. In fact, they must relinquish PAMED and come into mainstream and utilize the public facilities that they preside over.
Yeah, it reminds me of an adage, actually, that I once heard from a lecturer who spoke about how the Minister of Health always has a health facility, so doesn't know what it feels like to not actually have health. And it's not just to Dr. Motsoaledi, just a lecturer having spoken with regards to that. Ultimately, we know what the solution is. We know where the problems lie. It's also going to be an issue for the president to actually speak about. And I say that just because if it's not understood at the very top, how do we break it down all the way to the bottom? Is it also just about trying to get the MMCs and your mayors, all of them involved in this fight as well?
Absolutely. What we've called for, and we'll continue to make this call, is that anyone who serves in the executive, anyone who's got the power of state as an authority figure, must actually utilize the public services, including your healthcare, because that's the only way where meaningful change can actually be effected. Until then, these people are so far detached from the happenings on the ground. There's a book, Animal Farm, that says all animals are equal, but some are more equal than others. This government and these executives, they are so detached. The social distancing from the people is so wide that they actually have got no clue what's really happening in the ground, because, like we've indicated, they are insulated, and we need to deal away and really crack that system of them being private when it comes to accessing services, but they still authority on the public system.
Very quickly, I've got two more questions, but one, the first one, the strike with COSATU, that's still set to take place today, gathering point at the Union Buildings with the destination to National Treasury?
I'm actually late. We're starting at 10. I'll be joining the comrades very soon. But
Yeah.
Indeed, that is set to happen. As indicated, it's COSATU and all its affiliates and various other civil society organizations, which are going to be participating.
We appreciate you giving us your time in heading to that as well. Just very quickly, a word then on PEPFAR ultimately being brought back and rescinded then, having been taken away for 90 days. Now that 90-day provision that it stays on board then as well. Your sentiment on that? Do you know what happens post the 90 days, however, as well?
Yeah, look, I think this is a good and very sharp wake-up call for African governments, not just us in South Africa, that we must cease to rely on the Western powers. I think this so-called 90 days that we have is not guaranteed, because the erratic nature of the United States government in this particular moment is scary. So I think from ourselves as a responsible government, we really need to sit down as a matter of agency, put systems in place to absorb those workers who have been providing this service, to ensure that there's no service interruption. But that must unfortunately be stomached by the South African government, because if we're going to say we're hoping that something is forthcoming from the US, we don't even pay American taxes. So, I mean, that's really a myopic approach to things. We need to come up with a solution that will be long-term for the South African population without relying on foreign powers.
Dr. Cedric Sihlangu, thank you so much for the time. Really appreciated a very, very important and interesting conversation there as well. The South African Medical Association Trade Union, that's SAMATU, that's the General Secretary there, having joined us for that discussion.